Now let's move on to our second chapter, which is at-home test we can do before we visit a doctor. As a chronic constipation patient, I have navigated through the complexities of chronic constipation way before I visited a doctor. As I said earlier, even as a scientist of my own body, I wanted to understand what is really causing it. Today, I understand the different causes and broadly three categories. One is the lifestyle causes, second is the physiological causes, third is the neurological causes. In the physiological, I also mentioned emotional, uh, psychological, and so on. So let's get to understanding what are some of the at-home tests that we can do that gives the preliminary ideas that what is really causing it. And also, I want to double score or underscore that this is not a replacement to the clinical test or clinical care. This is only for our preliminary understanding of what's causing it. And perhaps after this, it will require clinical diagnosis or the conversation with your provider to understand the root causes and to confirm it. But these general tests are essential in understanding and what is really causing it. And we'll go as extensive as possible. And let me walk you through the quick overview of its chapter. So we have 15, not just 10, 15 at-home tests that we can do to understand different root causes of it. Let me enumerate quickly. First, we'll understand low fiber diet. We'll do a dietary fiber assessment. Number two, we'll do a poor dietary habits. For that, we will do simple elimination diet. Number three, we will check for lack of fluid intake. For that, we will do hydration test. Four, we also understand that caffeine abuse and overuse of alcohol can cause constipation. So we'll keep a dietary log. Five, drugs can cause constipation as well. So we'll do a medication review. Six, sedentary lifestyle. For that, we'll keep a physical activity log. Seven, we know that endocrine disorders, so that's hypothyroidism, can cause. For that, we do temperature test. Eight, we know that neurological diseases or neuropathy can cause it. For that, we'll do sensory and reflex checks. Nine, psychological issues. We know that stress and mental health assessment is useful in identifying the psychological issues. Number 10, impaired colonic motility. For that, we'll use abdominal massage. 11, for gut dysbiosis, we'll talk about probiotic supplement. 12, for defecation disorders, we'll check whether a squat position during bowel movement can help. Number 13, pelvic floor dysfunctions, we'll use biofeedback techniques. Number 14, slow transit constipation, we'll use bowel transit time test with markers or beetroot test. Or 15, for potential colorectal issues, we can use home stool blood test. So we'll talk about one of all of these in detail and help you run a at-home test that will give you a preliminary idea about what's really causing it and also what treatments are working or not. So let's dive deep. So let's start with our first cause, low fiber diet. And in order to test that, we will do dietary fiber assessment. So our purpose is to evaluate whether fiber intake is related to the digestive health. And this is how you can run it. So keep a simple diary for a week and measure the fiber intake and compare it against the dietary recommendations. For example, for women, it's about 25 grams per day, and for men, it's 35 grams at minimum per day. And you can use Bristol Stool Charts for objective evaluation of your stool. For example, type 1, 2, 3, 4, 5, 6, 7. Then what are shape of your shape, size, smell, and other consistency, and so on. You can measure it objectively using Bristol Stool Chart. And if you have consistent low fiber diet and it's impacting your Bristol Stool Chart, usually to the type 1, type 2, which are more score shape, or the golf ball shape, or the very thick log like, then you know it's chronic constipation, it's causing it. The second test we can run is to check for cause of our chronic constipation. That could be our poor dietary choices or poor dietary habits. And the test we can run is a simple elimination diet. The purpose is to identify food intolerances or sensitivities that can cause chronic constipation or impair our gut health. For example, we can eliminate some of the trigger foods, such as for some people it can be dairy, for some people it can be gluten, soy, or certain high FODMAP foods. What we can do is we can put a food diary and eliminate all of these and then introduce one after another that can help us identify what is the trigger food that can help that's causing a chronic constipation. For example, in my case, dairy is not a problem, but even gluten is not a problem. I am not allergic to gluten, but if I use a huge amount of wheat, that can have some offsetting problem for me. But when I combine cheese and the white flour, that's a trigger for me that can cause chronic constipation. So to do that is simple elimination diet before and after. Then we can gradually start reintroducing it, and we can keep eating what doesn't trigger and eliminate what causes the problem for us. So this simple elimination diet can identify the trigger food element for us. The third cause is lack of fluid intake. What that means is dehydration. And we can do a simple hydration test. And the visual hydration test that we can do is a urine. So number one thing is we may be less frequently urinating it. And when we go, and the color of the urine will be, if you are not drinking enough water, will be dark yellow, or even severely dehydrated. It could be brown. The ideal color should be slightly light yellow or crystal white. And if you're drinking too much water, obviously frequency of urination would be higher and the color of the urine would be very, very crystal white. So that's how we can know we are dehydrated or not. Another factor we can clearly know is when we look at our Bristol Stool Chart, we may have more difficult dry stool. What happens is when the stool has to pass through from our digestive tract, in lack of insufficient water, our intestines will draw water from the stool and it will make it more dry and it will be difficult to pass through it. Even the gut motility will be impaired. So simple test is hydration test, and urine is a great example. And you can find other symptoms as well. For example, your lips can turn dry. Another symptom is you can start getting pimples on your face. I know that because I had dry lips and the pimples on the face, and that gets particularly severe during the winter because I live in Boston and the winters are quite dry inside the house. So the simple thing is to use humidifier so that there is hydration, there is moisture around going on in the environment. Another thing is to deliberately start increasing the water, and you can check whether your water intake is impacting or not, usually using visual inspection of the stool following the Bristol Stool Chart. And here is how uh, hydration test can inform you that whether dehydration is the cause of constipation. Let's talk about the fourth one, caffeine abuse and overuse of alcohol. So, in order to do this, we can simply use a dietary log test to monitor intake of caffeine and alcohol and its effect and their effects on the bowel habits. To do so, let's keep a dietary log in which we are measuring the amount of caffeine and alcohol that we take, and obviously how it impacts a bowel movement. And for objective evaluation, we can use Bristol Stool Chart, which I've explained many times. And we can do it for months and weeks and months, and then realize, okay, if there is a direct correlation or causation between our caffeine intake and alcohol intake, then we can confirm that it's because of caffeine and alcohol or alcohol. We don't have to do it pair it. We can isolate one particular variable, which is whether alcohol or caffeine, and we can run this experiment using a dietary log test and then identify the cause of our chronic constipation. And the reason why caffeine and alcohol I mentioned here is both of these elements are diuretic. That what that means is that promotes loss of water through urine, and that will contribute to dehydration. And when dehydration happens, obviously the stool becomes harder, it becomes cracks, and it's difficult to pass. Even the stomach lining becomes coarse and dry, so it's difficult to pass. It impairs gut motility. That's how it impacts chronic constipation. So do a dietary log test and identify yourself whether caffeine or alcohol is contributing to your chronic constipation. And number five cause is medication and drugs. The NSAID is medication for cardiology disease, liver functions, kidney disease, metabolic functions can also contribute to constipation. And in order to identify whether these medications are contributing, then what we can simply do is do a test for medication review. So to identify whether these medications are contributing to constipation or not, and list all the medications that we're taking, when you started taking, what's the doses amount you're taking, and then measure it is with the Bristol Stool Chart and start indicating whether type 1, type 2, type 3 bowel movements, and you take it for a multiple number of weeks, then you can have the data, and that data will help you identify whether those medications are causing or not. And sometimes it can be one medication, sometimes it can be a combination of multiple medications, and that richness of data will be helpful when you go to doctor's visit, and then doctor can obviously recalibrate the medication or dosages, or even give you another type of medication that may not impact chronic constipation, or they can pair it with some other form of medication that can induce have a laxative effects, because those medication may be absolutely necessary. Again, the medication review can tell whether those medications are impacting your chronic constipation. And if it's impactive, you can exactly identify the start date and the severity of that impact based on dosages. So do a medication review test to identify whether medication is impacting. Simple example is NSAIDs like ibuprofen can impact chronic constipation. Even the supplements, which such as the iron supplements, can impact chronic constipation as well. So do a comprehensive medication review test to identify whether medications are impacting your chronic constipation. And number 6 cause is sedentary lifestyle. And in order to test that, keep a simple physical activity log. And it will help to correlate physical activity levels with gastrointestinal health, such as our chronic constipation. And I did that. I went and did this test and identify if I don't walk at all, then the next morning I had severe constipation. I really have to push it hard, and my stools are very lumpy. Even when I am not doing any physical activity, my desire for drinking water or the thirst for water is less. So, in general, a sedentary lifestyle can hurt uh, the cause chronic constipation. And when I measured it, if I do not even move for 2,000 steps, less than that, my constipation was way harder. So that's how I was able to identify, okay, sedentary lifestyles can cause chronic constipation. It may not be the only factor. There are multiple factors that contribute, but this can be one of the huge factors. The reason why is physical activity impacts the gut motility. Gut motility is the movement of a stool across the digestive system, from small intestine to large intestines and through the rectum. But when you are not moving, then there is no sterolysis happening. I find it really difficult to pronounce that word, sterolysis, which is like pushing the muscles, pushing the stool downwards. And that doesn't happen properly. That'll impair the gut motility and cause chronic constipation. And when I start keeping it log, I was able to pinpoint saying, okay, even as much as 2,000 steps can be helpful. And then incrementally, I started adding more steps, 5,000 steps, 10,000 steps. Then I started running, started doing yoga, started doing HIIT. And that's how I'm living constipation free. So therefore, physical activity log can help identify and pinpoint whether sedentary lifestyle is contributing or causing to chronic constipation. Do this simple physical activity log, and that will help you identify the root cause. Now let's talk about our 7th test, which is to measure endocrine disorders, aka hypothyroidism. So the test we'll conduct is called temperature test. Every morning before we wake up, take the basal body temperature and take it for several days. And if it shows consistently low temperature, then it can indicate hypothyroidism, which can slow down the metabolic processes. And slowing down metabolic process can result in causing chronic constipation. So that's the correlation between slow metabolic process, and that is because of hypothyroidism, and that can cause indicated by lower basal body temperature for several days and consistently low basal body temperature. And obviously, this is not a complete diagnosis. It is just an indication to get an idea whether there is a slow metabolism going on. We know that neurological disorders can also contribute or cause to chronic constipation. And we can do by a simple test, which is called sensory and reflex checks. So to identify neuropathic issues affecting bowel movements, we can perform a simple basic sensory test like pinpricks or light touch in a different parts of the body, and we can test for reflexes. And if there is a reduced sensitivity or reflex action is slow, then we can somehow learn from that is there is some neurological disorders. And if available, we can also test that with reflex hammer if available. The slow to respond to reflexes can indicate neurological disorders. Of course, the caveat here is it's not definitive, it's not diagnostic. Obviously, we need neurogastroenterologists to diagnose that. But again, before we visit the doctor, these tests can simply help us get a general idea whether that may be the cause of our chronic constipation. Number nine, we know that psychological issues can also cause chronic constipation. And in order to test that, we can use stress and mental health assessment to identify psychological factors contributing to constipation. So, by simply keeping a daily journal detailing stress levels, mood, and bowel habits, we can use online validated stress or anxiety assessment tools if available. When we measure that stress and the bowel habits, we'll be able to correlate and identify the causes. In my case, I did that. So when I learned the following: A, whenever I'm stressed, I have a chronic constipation. When I sleep less, I triggered chronic constipation. And whenever I start doing more meditation exercises, my constipation was reduced. So I was able to measure that objectively using Bristol Stool Chart. So journaling stress and anxiety and mental health assessment can help you identify whether there are psychological issues causing chronic constipation. So number 10 cause is can be because of impaired colonic motility. And in order to test that, we can simply do abdominal massage for 10-15 minutes and check whether it stimulates the bowel movement and relieve constipation or not. So the process how to do that is just massage the abdomen in a clockwise for 10-15 minutes. 10-15 minutes like this. And then check whether it triggers bowel movement or not. If it does, then it's an indication that you have some form of impaired colonic motility. And the reason why it's the clockwise help is the large intestine starts from the left side, and when you move towards the clockwise direction, you're helping and pushing the stool in the large intestines manually, and that can be helpful. So simple abdominal massage can help us indicate whether our impaired colonic motility is impacting or causing our chronic constipation. Number 11, we know that gut dysbiosis can also cause chronic constipation. And in order to test that, we can simply run a test of probiotic supplement trial to assess if probiotics can alleviate constipation symptoms. So we can try probiotics as a supplement or in form of fermented food for 2 to 4 weeks or 6 weeks period of time, and then start measuring our impact on bowel movements. So if there is an impact, if there is which alleviates our symptoms, our shape, size, time, effort, everything starts reducing and towards getting the type 3 or type 4 of the Bristol Stool Chart, then we can know that we had got dysbiosis and probiotic supplement has some impact in that. Obviously, it may not be enough, but it can be helpful. Probiotic supplement trial can be helpful to get some indication that we have got dysbiosis that's causing chronic constipation. Number 12, defecation disorders can also cause chronic constipation. Now, in order to test that, we can simply do a bowel movement in a squatting position to check whether that position will facilitate easier and complete bowel movements. So what you can do is take any stool, elevate, put your feet on top of that so that the knee is higher than your hip, mimicking a squat position. So what that'll help is it'll help push the abdomen and also the rectum in a more straight line instead of a pipe. For example, our rectum should be like this straight vertically, but when you are in a sitting chair position, it becomes like this. So there is a blockage in here. So when you are in a squat position, it becomes straight and it is helped to defecate more easily and for complete bowel movement. And that helps, then that indicates some form of defecation disorder. It may not be extreme or it may be extreme. That can be diagnosed later. But if the squatting position is helpful, that can alleviate the chronic constipation symptoms, then that can indicate some defecation disorders. Again, for some, simply mimicking the squatting position can be enough. For others, there may be more treatment required. always consult with your doctor. But it's a simple test you can do. Mimic the squat position while during the bowel movement. Number 13, pelvic floor dysfunction can also cause chronic constipation. First of all, what is pelvic floor? So pelvic floor muscles are those muscles that support a bladder control, bowel function, and sexual health. So when these muscles doesn't work as it should, then it indicates pelvic floor function. So some of the symptoms you might see are: number one, you have urge to go all the time, but actually you don't need to go. That's number one. Number two is when you sneeze, laugh, or do exercise, there's an accidental leaking of urine. That's again. And third is sometimes you lose control over bowel or bladder control. So if you have these symptoms that indicate you have pelvic function, pelvic floor dysfunction. And there is a simple test that you can run. Number one is simply sit down and then try to contract your pelvic floor muscles, like as if you are trying to stop the flow of urine, and hold it for a few seconds and then relax. You can try that a couple of times or times and then realize whether you are able to do that or not more comfortably. And there is an issue in doing that that can indicate that you have a pelvic floor dysfunction. So other time you can try during urination. While continuing urination, you can try to stop urination and hold it for a few seconds. And if you're able to do that, then obviously your pelvic muscles can control the bladder. That means you don't, that indicates your pelvic floor muscles are working as it should be working. But if you can't do that, that can also indicate pelvic floor dysfunction. And third, which is more goes to a diagnostic side of it, is using a biofeedback. So biofeedback is you put some kind of equipment and you try to control the muscles after a certain stimuli, and whether you're able to do that or not, that can also tell that more definitively whether you have pelvic floor dysfunction or not. And how can you improve pelvic function when you realize that you have that is causing it? So there are multiple ways of doing it. I'll categorize into at home and after the post diagnosis from a clinician. So at home, you can start doing Kegel exercises, you can doing deep breathing exercises and pelvic floor stretches during yoga or any other form of exercises that can be immensely helpful to strengthen the pelvic floor muscles. And other is using biofeedback mechanisms with equipment and also physiotherapy from the physiotherapist or physio gastroenterologist. They can help you improve your pelvic floor muscles. So simple ways to test it: one, you can actually sit comfortably, hold the uh, hold the muscles, contract the pelvic floor muscles as if you're trying to hold the urine. That's one. Or try to hold the urine while urination. And third is using biofeedback. So this is how you can check whether you have pelvic floor dysfunction that's causing your chronic constipation. And obviously, this is the preliminary indication, not a complete diagnosis. For that, you'll have to consult with your doctor. So, number 14, slow transit constipation can cause chronic constipation as well. So, what that means is it takes longer time for your stool to travel along your digestive tract. So, how can you simply measure that? How long does it take and confirm whether it's because of slow transit constipation? There are multiple ways of doing things. Number one way is to very simple at-home test, which is called beetroot test. What you can do is you can drink a glass of beetroot and then expect to have a red stool within 12 to 24 hours. And if you do not get red stool in that particular time frame, that can be the indicative that you have slow transit constipation. So what that means is you have impaired gut motility. So gut motility is the movement of the stool in the digestive tract, and that can be impaired by many things. One of the things is obviously the neurological reasons in the gut area. Another could be the physiological reason is that because of lack of movement or exercise, the gut motility is impaired. So those are a couple of reasons that can cause gut motility. And if your chronic constipation is caused by impaired gut motility, which can categorize as slow transit constipation, this beetroot test can indicate that. So another way of again measuring the slow transit constipation is taking a capsule and adding a marker and ingest that and record how long does it take to come out during the bowel movement. So that is most commonly done using with collaboration with the healthcare provider. But again, this capsule or the beetroot, either of them can indicate whether you have slow transit constipation if it's taking more than 24 hours or more than that. So these are simple tests to monitor the passes of food and stool through the digestive tract. And if it takes longer than 24 hours, that indicates you have slow transit constipation. Now we come to the last, the number 15. So chronic constipation can also be caused because of colorectal issues. And one of the ways to identify that is to check whether there is blood in our stool or not. And in order to verify that, we can conduct home stool blood test in order to check for hidden blood in the stool. And if there is blood in the stool, it can indicate more severe digestive problems. And obviously, we can do in two ways. Number one is the visual way. And when after our bowel movement, we can observe our bowel movement and check whether there are blood in our stool. For example, the blood could be in different colors: bright red, dark red, brown, and even darker. So each of these colors can indicate the origin of the blood. For example, black can indicate its origin is stomach, or brown can is small intestine, and as you go lower and lower, it can the brightness of red decreases. And if it is bright red, it can be hemorrhoids or fissure. So that visual inspection can tell whether we have other digestive issues that's causing chronic constipation. So another way is obviously there are invisible blood markers, and that can be tested using at-home test that can indicate whether we have other colorectal issues. And some of the over-the-counter blood test kits are the following. Number one is Easy Detect stool blood test. Number two is Hemo Occult Sensa. Number three is Coloscreen. Number four is Immunochemical Fecal Occult Blood Test. And Easy Detect stool blood test and Hemo Occult Sensa is over the counter. You can do it at home. A coloscreen and immunochemical fecal blood tests that needs to be sent to the laboratory, but that still can be done at home at as a much lower cost than other invasive procedures. These are non-invasive ones. When we do these tests, visual inspections or over the counter or laboratory, we can, if you find trace of blood, then that needs to be confirmed by other more invasive or other laboratory test. But again, at home test can give us more indication that whether we have other form of colorectal issues or digestive issues. Best case scenario is that we don't have blood. In my case, it was bright red, so it was because of hemorrhoids and fissures. And when they did colonoscopy, they couldn't find anything as well. There is no bleeding or in my rectum, or there is no bleeding in my large intestines, and and so on. So it was fairly, in the scheme of things, less concerning. But again, blood in stool is always concerning. But this home test can help us detect whether there is visible or invisible blood. And when we find any trace of blood, the wisest decision we can make is contact the healthcare provider and further diagnosis so that we can get a treatment as soon as possible, because our chronic constipation is merely the symptom of more severe diseases. With this, we have come to the end of this chapter, the essential at-home test to get preliminary diagnosis or indication of our causes of chronic constipation. And I want to add a disclaimer here. I have said it again and I'm going to repeat it. These tests are only for information purposes only. These are not the substitute for more clinical medical diagnosis. If you have severe symptoms, abnormal pain, if you have weight loss or see blood, please immediately contact your healthcare provider. This video is only for information purpose only, so that we can help you become scientist of your own body, document your symptoms better, and be educated in understanding the root causes of it, and have a very educated conversation with your healthcare provider. So that's our objective here, not to substitute for clinical advice or medical care. So before we move on to another chapter about listing different clinical tests to confirm the diagnosis of it, because we know that many people suffer from navigating different tests. And as I told earlier in our previous episode, you need to fight like an MMA fighter to get the test done, which may sometimes have to go beyond gastroenterology to a neuropathy or psychology or or endocrine disorders or cardiovascular disorders, so on. So we'll talk about all of those tests, and so that it gives you a more idea that clinical tests are necessary and which test may be the right one for you to get the accurate diagnosis so that you can shorten the path of recovery. So before we go into that, let's quickly summarize 15 at home tests we discussed earlier. We talk about number one, dietary fiber assessment for low fiber diet. We talk about simple elimination diet for to test for poor dietary habits. We talked about number three, hydration test for lack of fluid intake. Four, keeping a dietary log for caffeine abuse or overuse of alcohol. We talk about doing a medical review to check whether medications are causing our constipation. Number six, keeping a physical activity log for sedentary lifestyle, conducting a temperature test, basal body temperature test for indicating endocrine disorders such as hypothyroidism. We, sensory and reflex check number eight for neurological diseases or neuropathy. We talk about number nine, stress and mental health assessment for psychological issues. Number 10, abdominal massage test for impaired colonic motility. Number 11, we talk about probiotic supplement trial for gut dysbiosis. Number 12, we talk about squatting position during bowel movement to test for defecation disorders. We talk about biofeedback techniques and beetroot techniques. Number 13, to identify pelvic function pelvic floor dysfunctions. And 14, to make to test for slow transit constipation. We talked about beetroot test and time test with markers. I'm sorry, I have a correction to make in pelvic function disorder. We talk about con- two ways. One is biofeedback technique. Another is contracting and relaxing the pelvic floor muscles holding the urination. So we talk about that for pelvic floor dysfunction. For 14, for bowel transit time, for slow transit constipation, we talked about beetroot test and capsule marker. And for 15, to identify potential colorectal issues, we talk about home stool blood test. So all of these blood tests are non-invasive mostly, except for the capsule ingest one. But again, that's fairly harmless in comparison to other invasive such as endoscopy, colonoscopy, or sigmoidology. Those kind of tests, and these tests can be done at home. This can educate us immensely about what's going on inside our body and understand these physical biomarkers that can help us become scientists of our own body. Because, as I said, most of the chronic constipation we can attribute the cause to our lifestyle, uh, for diet, exercise, nutrition, hydration, and so on. And we can experiment and realize the root cause of it. Then we can take a remedial step. For example, even for pelvic floor dysfunctions, gut motility, we can do at-home exercises at zero cost, which increase our pelvic function control, function, floor control. For that, we can do Kegel exercises, breathing exercises, and yoga, and so on to increase our control over pelvic floor muscles. So we can do that. So most of I would say, is self care. And when we understand these indicators and understand the root causes, we can take our preventative action and we can recover from it. And obviously, there are cases in which it's much more than lifestyle. It can be psychological, neurological, and other digestive disorders. Then to do that, to get a correct diagnosis, we can use this test as a certain indication for education, but that needs to be supplemented at by clinical test. And that's what we are going to talk about next. Stay tuned.